and Senator, you might like to second the motion, please.
Yeah. Thank you, Laska Hirlock. I would like to formally second the motion, and I'm delighted that the Fianna Fáil senators are also in agreement with the motion. I think it's great, and another example of the work that we can do in the Seanad and have cross-party support. Once again, I'd like to formally congratulate Minister Varadkar on his appointment. Wish you all the very best of luck in this very challenging role, which I have no doubt that you will be very successful in. I wish you all the best. I'm delighted to formally second the motion, as I said here today. Helen Keller once said, of all the senses, sight must be the most delightful. I think a very, very true statement. And as I said, I would like to welcome the Minister to the House today. I'd also like to welcome members from the National Vision Coalition who are here today for the debate as well. It's quite a startling statistic to hear that up to 80% of the world's blindness is avoidable. And it's this statistic that the World Health Organization has focused on in their Vision 2020 programme, which aims to eliminate avoidable blindness by 2020. It's almost 10 years since the Irish Government committed to the objectives of Vision 2020, and in those intervening years, there have been many positive developments in tackling the issue of avoidable sight loss in Ireland. The policy document Healthy Ireland, which the Government published in March 2013, provides a framework for action to address the health issues of all, with an emphasis on prevention and early intervention. The establishment of the HSE National Programme for Eye Care is a key element of this objective, with a focus on prevention and early intervention, equitable access to efficient high-quality care, supports and treatments, and the development of cost-effective care pathways, with the person at the heart of the process. Their overall aims are to reduce the number of annual cases of preventable blindness and visual impairment, and to maintain the vision of those with impairment for as long as possible, enabling them to live independently. There are currently 224,000, or just over it, 1,000 people living with low vision and sight loss in Ireland. 5 people per week. I think and I thank Senator Conway for bringing this, because there were many facts here that I just simply was not aware of. 5 people per week became blind between 2010 and 2013, and this figure is likely to rise as our population ages, unless we take remedial action. The current Central Statistics Office projections estimate that the number of people aged 65 and older in Ireland will almost double over the period 2006 to 2026. Unfortunately, as we age, we are at an increased risk of vision loss due to increased likelihood of developing diseases such as diabetes, glaucoma, cataracts and macular degeneration. Diabetes is fast becoming a global epidemic, with 366 million people living with this disease worldwide. The main cause of blindness associated with diabetes is diabetic retinopathy. Poorly controlled blood sugars, high blood pressure and high cholesterol increase the risk of developing vision problems. The establishment of the Diabetic Retinopathy Screening Programme, which commenced screening in March 2013, has been a very important development in the early intervention and treatment of this condition. The programme offers free, regular screening to people with diabetes aged 12 and over, and at the end of 2014, invitations to attend screening had been sent out to 109,000 people, with the remainder of the 145,000 on the register to be seen by the end of the year. Traditionally, the provision of eye health in Ireland has been based on a community approach, with the aim of providing countrywide services which are accessible to the service user. The benefit to the client is that they can be seen and treated in their local area by the ophthalmic team, and this fits in well with the emphasis on early detection of potentially serious conditions. The National Programme for Eye Care has reviewed the school eye screening programme currently provided by the HSE, with a view to incorporating best international practice on the screening of children. As a result of this review, there will be changes in the National Vision Screening Programme to ensure that children who fail the screening have quick access to specialist services, which are vital. There are also plans to expand the role of orthopists and optometrists, working on the governance of an ophthalmologist, as well as comprehensive training for public health nurses and area medical officers, all of which will have a positive impact on waiting times and patient numbers. The National Vision Coalition produced the report called Economic Cost and Burden of Eye Diseases and Preventable Blindness in Ireland. And as I said, I'm delighted that members are here today, detailing the impact of sight loss on a person. Not only is it a major personal tragedy, sight loss also has a significant economic impact on individuals, families, society in general, and the state. 2.1 million healthy workdays are lost each year in Ireland, and the financial cost to the Departments of Finance, Social Protection and Health was €386 million in 2012, which is expected to rise to €449 million by 2020. However, it is estimated that savings of up to €76 million could be made annually if there were effective early intervention and treatment programmes in place. In addition to having a hugely significant impact on the lives of people at risk of sight loss, the return on investment from a state perspective is considerable and one which we need to consider seriously as our population ages. The National Vision Coalition sets out in their report the need for us to build on the strong service delivery record and commitment of the various professionals who work in the area of eye care in Ireland. There is a very wide range of services and service providers working in this field, supporting the 220,000 people living in this Ireland who are blind or visually impaired. There is certainly a need for a greater level of integration and coordination to ensure that resources are used in the most optimal way. The two main areas for us to focus on are preventative services and supports, and also to review how we can make life better for people with sight loss by promoting inclusion, participation and independence for them. I would ask you, Minister, to implement whatever strategies are necessary to continue the work which has begun and to ensure that the objectives of Vision 2020 are met. And if I could just conclude by saying again that I would like to thank Senator Conway and the Fine Gael senators for putting forward this motion tonight, and also welcome the fact that we will hopefully have cross-party support for this motion. Thank you.